This is our third and final portion of the antiepileptic drugs. Let's start with lamotrigine or Lamictal. This is also used in the treatment of bipolar disorder, and it can be used for simple or complex partial seizures. The contraindication for this medication is a drug allergy. We will see that it may cause dizziness, the relatively minor CNS effects and GI symptoms, but sometimes fatigue or insomnia, possibly Stevens-Johnson syndrome. With levetiracetam or Keppra, this is an adjunct therapy used for partial seizures with and without secondary generalization. I will say that more commonly now that it's becoming a monotherapy drug as opposed to an adjunct therapy. Its contraindication is a known drug allergy to levetiracetam. It's used for partial seizures. It can cause drowsiness, weakness. The mechanism of action is unknown, and the adverse effects are generally well tolerated. They're usually CNS effects like that weakness. But one of the things that can happen with this drug that does frequently happen is that they have nasal problems. They feel like they have a cold all the time and some drainage, sinus drainage. So we have to educate our patient that although there are no serious drug interactions, they should not be taking over-the-counter medications to relieve that stuffiness. If it becomes a problem, they need to talk to their healthcare provider about it rather than take things like NyQuil or Sudafed. So the other thing that happens with levetiracetam is that it can cause a susceptibility to infections. It can lower the white blood cell count. And so sometimes the patient, because they already feel like they have a cold, they may not treat or seek treatment for an infection until it's further advanced. With pregabalin or Lyrica, this is a Schedule 5 controlled substance. We see it typically ordered more commonly for neuropathic pain like fibromyalgia or postherpetic neuralgia, but it is an adjunct therapy for partial seizures. The contraindication for it is a known drug allergy, and it's primarily has central nervous system related adverse drug reactions. With our tiagabine or Gabatril, this is an adjunct therapy for partial seizures as well. We will see this being used less frequently, but the beneficial effects are related to the inhibiting of the reuptake of the GABA. So it inhibits the uptake of the GABA into the presynaptic neurons, and it prolongs that GABA action. So sometimes the adverse effects will result in stuttering or a loss of sensation in the fingertips. It can also cause confusion. We do avoid off-label use of this drug because it can actually cause paradoxical seizures in a patient who does not have seizures, but perhaps one of those other disorders that we use some of the anti-epileptic drugs to treat. With our topiramate or Topamax, this is an adjunct therapy for partial and secondarily generalized seizures, or for general tonic-clonic seizures, also for drop attacks, and in a condition called Lennox-Gastaut syndrome. So Lennox-Gastaut syndrome, that of course is an eponym named after two scientists, Henri Gastaut and William Gordon Lennox. And it's a form of early childhood epilepsy that's marked by an atypical presence of atypical absence and tonic-clonic seizures with a slow spike in the electroencephalographic waves. And this also is accompanied by a high incidence of mental retardation or developmental delay. So this Topamax is used for treatment of that. The mechanism of action of Topamax is unknown. It's thought that this sugar-like chemical molecule enhances the action of GABA. And so it is also useful in the treatment of trigeminal neuralgia. It can cause weight loss, numbness and tingling of the fingers and toes, behavioral issues including depression, agitation, and hostility. This actually is also sometimes this particular drug, not in epilepsy, but is used in a combination drug with phentermine for weight loss because we know that it has that effect. Its adverse effects are CNS related, and it can also cause angle closure glaucoma, excuse me. Valproic acid is another drug used in the treatment of generalized seizures. We also see it used in bipolar disorder and for controlling partial seizures. This drug is highly protein bound. Its mechanism of action is the same as phentoin, but the effects of GABA and calcium, the effects on the GABA and the calcium channels can cause some additional actions. So it's useful for this wide range of seizure types because of that. We also will see this used in the treatment of migraine headaches, and it has several trade names. But when we use this drug, we'll see adverse effects that include drowsiness, GI disturbance, a prolonged bleeding time. We may see a tremor, weight gain, hair loss, a rash, pruritus, a condition called erythema multiforme. We can also get fatal hepatotoxicity or pancreatitis, so it's always used in caution. It comes in oral and injectable forms. Now, as I said, it can cause a prolonged bleeding time, so we would not want to use this with warfarin, aspirin, also using alcohol. Those could cause severe bleeding. We also obviously wouldn't use it with any other CNS depressants. It does have a black box warning for the fatal hepatic failure that can occur especially in children under the age of 2, and very nonspecific symptoms often precede that hepatotoxicity. So they'll have weakness, facial edema, anorexia, and vomiting. We would do liver function tests prior to starting this treatment and at specific intervals during the first 6 months of treatment. Valproic acid with pregnancy can produce teratogenic effects, including spina bifida. Zonisamide or Zonegran. This is a sulfonamide derivative, so we would want to be sure that we don't have a patient that's allergic to sulfa medications. It's considered a broad spectrum medication, typically used for partial seizures, but can be used for a variety of seizures. It does have adverse effects that are CNS related and GI symptoms. What are the nursing implications for these medications? Well, of course, we want to do our health history. Our assessment would include current medications, drug allergies, liver function studies, CBC, baseline vital signs. With these oral drugs, we want to be sure that they know to take them regularly at the same time each day, take them with meals to reduce the GI upset, and not to crush, chew, or open any extended release forms. If the patient's NPO for a procedure, you want to contact the physician regarding the AED or anti-epileptic drugs. I haven't used that abbreviation in this presentation, but it is in your textbook. So AED in this context stands for anti-epileptic drugs. Which brings me to oral, and we're talking about food. The other thing that you'll see used in the treatment of seizure disorders frequently is CAM therapy, is the ketogenic diet for epilepsy. And it can be used sometimes when seizures cannot be controlled through pharmacotherapy or when there's unacceptable adverse effects. Now, the ketogenic diet is a very strict diet that's high in fat and low in carbohydrates and protein. It limits water intake and it carefully controls the caloric intake. Each meal has the same ketogenic ratio of 4 grams of fat to 1 gram of protein and carbohydrate. extra fat is usually given in the form of cream. Research suggests that the diet produces a high success rate only for certain patients, though, and the diet appears to be equal effective for every seizure type. Now, the most frequently reported adverse effects of the ketogenic diet are vomiting, fatigue, constipation, diarrhea, and hunger. Kidney stones, acidosis, and slow growth rates are also possible risk. So if the person is on a ketogenic diet, the provider needs to know that. So while you're talking about this, it's really important that the patient understand that the ketogenic diet is not a do-it-yourself diet. And I know a lot of people are using it for weight loss as a do-it-yourself, but it could be harmful if it's not monitored carefully by a skilled provider and a skilled professional. So when we look at the intravenous forms of these drugs, we want to be sure we're following the manufacturer's recommendations for IV delivery. This is usually given very slowly. We want to monitor vital signs. We want to avoid extravasation, of course, because these are very caustic, and we use only normal saline with IV phenytoin. We want to teach our patients to keep a journal to monitor their response to the antiepileptic, their seizure occurrence and description of the seizures, any adverse effects. They should have some sort of a medical ID alert tag or identification. Antiepileptics, as we said earlier, should not be discontinued abruptly. You can have status epilepticus as a result of that. Driving can be impaired until the drug levels stabilize, and in most states, these patients are not going to be able to drive for at least a year until they have been seizure-free for at least a year. Patients need to know that therapy is long-term and possibly lifelong. It's not a cure. We'll teach the patient to monitor for the therapeutic effects. We want to see the seizure activity decreased or completely absent, and to monitor for the adverse effects, particularly those mental status changes, mood changes, changes in level of consciousness or sensorium. Any eye problems or visual disorders need to be reported. Sore throat, fever, blood dyscrasias may occur with the hydantoins. Remember, they can also occur with your Keppra or the levetiracetam. Then we want to monitor for the many other side effects based on what medication the patient is taking. Safety, look alike, sound alike. Be very careful with these drug names. They sound very familiar. When we're using trade names like Cerebyx, we don't want to confuse that with Celebrex. Sound very much alike. They look very much alike. They're quite different. And speaking from personal experience, I have given a verbal order over the phone where the patient was being ordered Celebrex and was given Cerebyx. So we will be sure that if we're using these names that we want to spell them out, read them back to the pharmacy or read them back to the provider if you're taking a verbal order, and spell it. Use both the trade names and the generic names when at all possible. If you have any question, give me a call, post it in the discussion forum, text me, email. You know how to get a hold of me. I look forward to seeing you soon.